Latest on the coronavirus. More than 300 Americans who were taken off a cruise ship in Japan have arrived in the U.S.
Also among them are the 14 people who have tested positive for the illness. CBS 2's Dick Brennan in studio now with more. Dick.
Christina Marie, State Department officials say only after passengers were evacuated from the Diamond Princess did they learn that 14 had tested positive for the illness. They were not yet showing symptoms. They were moved to a containment area on the evacuation plane where they're being monitored. A plane carrying about a dozen Americans who were evacuated from a quarantine cruise ship off Japan arrived in Nebraska this morning. Hundreds of other American evacuees will be under a 14-day quarantine at U.S. military bases.
They have sent over a dozen emails assuring us that there would not be an additional quarantine. And they just told us that we'd be re-quarantined for 14 more days. I've just lost a whole month of my life.
But many passengers were relieved and praised the move.
I want to go somewhere where I can feel safe. And I just want to thank President Trump and the U.S. government. There's been a lot of silence on this, and now we know the silence has been putting together a brilliant plan.
The quarantine passengers will be monitored at the University of Nebraska Medical Center for signs of the coronavirus.
One patient was transported to the hospital, to the biocontainment unit, because of a chronic condition and also was experiencing some mild symptoms. The remainder of the patients were transported to the quarantine unit.
The World Health Organization reports that coronavirus, or COVID-19, is actually not as deadly as the SARS and MERS viruses. More than 80% of patients have mild illness and will recover. In about 14%, the virus causes severe cases, including pneumonia and shortness of breath. About 5% of patients have critical cases, including respiratory failure, septic shock, and multi-organ failure. In 2% of the reported cases, the virus is fatal.
We need resources now to ensure countries are prepared now. We don't know how long this window of opportunity will remain open. Let's not squander it.
The World Health Organization says the risk of death increases the older you are. They say they're not seeing many cases among children, and they're not sure why. Christine.
Okay, Dick, thank you.